Hello, seniors. I am Dr. Robert Harrison. Have you ever felt tingling, numbness, or a burning sensation in your hands or feet and wondered why it's happening? What if I told you that these could be early warning signs of a serious nerve problem and that the root cause might be a vitamin your body desperately needs? Many people ignore these signals, thinking it's just age or stress. But the truth is, your nerves may be screaming for help, and if left unchecked, the damage could become permanent. Today, we're going to uncover the vitamin deficiency that often goes unnoticed, how it affects your nervous system, and what you can do about it to protect your health. Let's start by understanding what neuropathy really is. Peripheral neuropathy is a condition where the nerves outside your brain and spinal cord become damaged. These nerves are responsible for carrying messages between your brain, spinal cord, and the rest of your body. When they're not functioning properly, your body starts sending distress signals: tingling, burning, sharp pains, or even numbness. Over time, weakness, poor coordination, and balance issues can emerge. It's more than discomfort. It's your body signaling that something critical is off. One of the most common but overlooked causes of neuropathy is a deficiency in a specific vitamin, vitamin B12. This vitamin plays a crucial role in maintaining healthy nerve cells and producing myelin, the protective sheath around nerves that ensures signals travel smoothly. Without adequate B12, nerve function deteriorates. Symptoms often begin subtly, which is why many people ignore them until the problem worsens. Early signs can be deceptive. You might feel tingling in your toes or fingertips, a sensation often described as pins and needles. Some experience burning pain in the feet, weakness in the legs, or difficulty walking. Others report a loss of balance or coordination, making everyday activities like climbing stairs or carrying groceries risky. Even subtle cognitive changes, fatigue, or mood disturbances can be linked to prolonged B12 deficiency affecting the nervous system. It's important to understand why this vitamin deficiency occurs. While diet plays a role, especially in strict vegetarians or those who don't consume enough animal products, other factors are often overlooked. Aging naturally reduces the body's ability to absorb B12 from food. Certain medications like metformin for diabetes or proton pump inhibitors for acid reflux can interfere with absorption. Chronic conditions such as Crohn's disease, celiac disease, or pernicious anemia can further compromise B12 levels. Now let's connect the dots between B12 deficiency and neuropathy. When B12 is insufficient, your nerves gradually lose their protective covering. Imagine electrical wires losing insulation. The signals become erratic, slow, or completely blocked. The result is the tingling, numbness, and pain we discussed earlier. If left untreated, nerve damage can become irreversible, affecting both your physical and cognitive health. But there's more to the story. Lifestyle factors can exacerbate this condition. Excessive alcohol consumption, smoking, and diets lacking essential nutrients accelerate nerve damage. Chronic inflammation and uncontrolled blood sugar levels, particularly in people with diabetes, further increase vulnerability. Essentially, your nerves are facing a perfect storm of deficiency, stress, and toxicity, making early detection critical. Medical research highlights the importance of early intervention. Studies show that correcting B12 deficiency can halt progression and, in some cases, reverse early nerve damage. Oral supplements, dietary adjustments, or injections are used based on the severity and underlying cause, but timing is everything. The sooner the deficiency is corrected, the higher the chance of recovery and prevention of permanent neuropathy. Here's a practical perspective. If you're experiencing persistent tingling, numbness, burning sensations, or unexplained weakness, a simple blood test can reveal B12 levels. Many people delay testing because the symptoms seem minor, but even mild deficiency can quietly damage your nervous system over time. Proactive testing is not just recommended, it's essential. Let's also touch on related nutrients. While B12 is critical, nerve health is supported by other vitamins such as B1, thiamine, B6, pyridoxine, and folate. These nutrients work synergistically, maintaining nerve function, energy metabolism, and cellular repair. A deficiency in one can stress the entire system, making comprehensive nutrition key to prevention and recovery. Understanding neuropathy also means recognizing when to seek professional care. Persistent or worsening symptoms such as severe pain, loss of sensation, or difficulty walking should prompt immediate consultation with a healthcare provider. Early intervention often involves identifying the root cause, whether it's vitamin deficiency, diabetes, autoimmune conditions, or medication side effects, and tailoring treatment accordingly. Beyond medical intervention, lifestyle strategies play a supportive role. Balanced nutrition rich in B vitamins, leafy greens, fish, eggs, fortified cereals, and dairy can help prevent deficiencies. Regular exercise improves circulation, which supports nerve repair. Avoiding alcohol and managing blood sugar levels reduces additional nerve stress. These small but consistent habits can make a measurable difference in long-term nerve health. In short, neuropathy is not just a consequence of aging, it's a warning. Tingling toes, burning feet, numb hands, or unexplained weakness are signals that your body may be lacking a critical nutrient. Vitamin B12 deficiency is a leading preventable cause. Recognizing the signs early, testing levels, and making dietary and lifestyle adjustments can protect your nerves, preserve your mobility, and maintain your quality of life. Your nerves are talking to you. Are you listening? Now that we understand the warning signs and causes of neuropathy linked to B12 deficiency, let's dive deeper into the science behind how this vitamin protects your nerves and why deficiency can be so damaging. Vitamin B12 is essential for the production of myelin, the fatty sheath that insulates your nerve fibers. Think of it as the protective coating around electrical wires. Without it, nerve signals become disrupted, leading to the tingling, numbness, and burning sensations we discussed. Beyond myelin, B12 is vital for producing neurotransmitters, chemical messengers that transmit signals between your nerves and brain. A shortage impairs communication throughout your nervous system, affecting everything from movement to sensation to mood. One of the challenges with B12 deficiency is that the body stores significant amounts in the liver, sometimes enough for several years. This means symptoms often appear slowly, making it easy to dismiss them as minor aches, fatigue, or just getting older. However, research shows that even mild, prolonged deficiencies can lead to measurable nerve damage over time. The key takeaway: subtle symptoms are still serious, and early detection is critical. Now let's break down the most common symptoms you should never ignore. Tingling or numbness in the hands, feet, or legs, often described as pins and needles. Burning or sharp pain, sometimes worsening at night. Weakness or clumsiness in the legs, making balance or walking more difficult. Cognitive symptoms such as brain fog, memory problems, or mood changes. Fatigue and low energy even when sleep is adequate. These symptoms can vary in intensity, often starting on one side or in one limb before spreading. Ignoring them can lead to permanent nerve damage, so timely testing and intervention are crucial. Let's also discuss risk factors that increase the likelihood of developing neuropathy from B12 deficiency. Age. As we get older, the stomach produces less acid, reducing the body's ability to absorb B12 from food. Dietary habits. Strict vegetarians or vegans are at higher risk since B12 is primarily found in animal products. Medications. Common drugs like metformin or proton pump inhibitors interfere with B12 absorption. Medical conditions, autoimmune disorders, celiac disease, Crohn's disease, or pernicious anemia can severely limit B12 absorption. Lifestyle choices, excessive alcohol intake, and smoking contribute to nerve damage and can worsen deficiency. Addressing B12 deficiency isn't just about taking supplements, it's about understanding the root cause and supporting nerve health holistically. Treatment strategies are often personalized. Dietary adjustments incorporating B12-rich foods such as eggs, fish, poultry, and fortified cereals. Oral supplementation available in tablets or sublingual forms for mild to moderate deficiencies. B12 injections reserved for severe deficiencies or conditions that impair absorption, ensuring rapid replenishment. It's also important to support overall nerve health. Other B vitamins like B1, thiamine, B6, pyridoxine, and folate contribute to nerve repair and energy metabolism. Antioxidants such as vitamins C and E can help reduce oxidative stress on nerves, while adequate protein supports nerve structure. Regular exercise promotes blood flow, helping deliver nutrients and oxygen to damaged nerves. For individuals with neuropathy from diabetes or other chronic conditions, managing blood sugar, inflammation, and lifestyle factors is equally critical. Chronic high blood sugar damages the nerves directly and impairs repair mechanisms. So, controlling these underlying factors enhances recovery and prevents further deterioration. Let's also address a common concern. Can nerve damage be reversed? In early stages, absolutely. Restoring B12 levels can halt progression and sometimes reverse symptoms entirely. Tingling and numbness often improve within weeks to months with consistent treatment. However, if deficiency persists for years, nerve damage may become permanent, emphasizing the need for early detection and intervention. Prevention is always better than cure. Here's a simple science-backed approach to protect your nerves. Regular testing, especially if you're over 50, have dietary restrictions. Take medications that affect absorption or experience early symptoms. Balanced nutrition. Prioritize B12-rich foods, leafy greens, lean proteins, and fortified grains. Lifestyle optimization. Avoid smoking. Limit alcohol. Stay physically active and maintain healthy blood sugar levels. Supplement wisely. If tests show deficiency, follow a healthcare provider's guidance for oral or injectable B12. Monitor symptoms. Track any tingling, numbness, weakness, or cognitive changes and consult your doctor promptly. In short, neuropathy isn't just an inconvenience, it's a red flag that your nervous system is under strain. Vitamin B12 is one of the most critical nutrients for protecting your nerves, maintaining myelin, and supporting overall nerve function. Recognizing the early signs, testing your levels, and taking corrective action can literally save your nerves and your quality of life. Your nerves are speaking to you. The tingling, numbness, or weakness isn't normal aging. It's your body signaling a deficiency that can be addressed. Don't ignore it. Take action now. Support your nerve health and protect your future mobility and independence. Remember, small changes today, like testing your B12, adjusting your diet, and improving your lifestyle, can have lifelong benefits for your nervous system. Early detection, informed intervention, and consistent care are your most powerful tools against neuropathy.